Good morning. Welcome to the Campaign for New York Health's press conference. My name is Melanie DeRigo, and I am the Executive Director for the Campaign for New York Health, a statewide coalition dedicated to passing and implementing the New York Health Act. The New York Health Act is a state single-payer healthcare bill that would provide comprehensive and upgraded healthcare to every single New Yorker, including medical, dental, vision, hearing, prescription drugs, and long-term care. What's more, over 90% of New Yorkers would receive all those benefits while spending less than they currently spend now in our broken healthcare system. We have long known that our healthcare system isn't working for the overwhelming majority of us. Premiums and deductibles are too high, insurance networks are too narrow, and too many of us have to choose between paying our bills and paying for our medication. If that wasn't bad enough, we now face looming federal healthcare cuts that will explode the cost of health insurance premiums, double the uninsured population in New York, and force hospitals to close around the state. But it doesn't have to be this way. New York can fight back by passing the New York Health Act, which would counteract the harm from the federal cuts and fix a system that has been broken for far too long. I stand here today with a growing coalition of support and a renewed momentum to put people before healthcare profit. I am elated to introduce this incredible lineup of dynamic New York Health Act champions as we call on New York to fight back against federal cuts and protect our healthcare by passing the New York Health Act. It is my pleasure to introduce our very first speaker, our prime bill sponsor in the Senate and #1 New York Health Act champion, the inimitable Senator Gustavo Rivera.
Good morning, Melanie, and good morning, everyone, folks who are joining us here in the panel, and as well as folks who are joining us from elsewhere. Gustavo Rivera, State Senator from the 33rd District in the Boogie Down Bronx, Chair of the Health Committee and prime sponsor of this piece of legislation since 2017. You will hear from one of the original sponsors in a second, but I'll be quick because we have a lot of folks that want to chime in about why this is so essential. And I'll actually do a little caveat to the introduction that Melanie had. I would argue that our current system is not broken. Our current system is working exactly as it is designed to do. And what that means is that it is not designed for the purposes of keeping people healthy. It is not built with the interest of patients or even providers in mind. It is built with profit at its core. That is the thing that when you stretch it out, the impact that has means that in this country, even though we are so wealthy, even though we are such a great country, we can actually go broke from getting sick. That is something that literally happens nowhere else. So we can do this. And what I will say about New York State is not only we have the opportunity, but I believe we have the obligation, particularly now, with the cuts that are happening from the federal government, and many of my colleagues here are going to speak about this. It is essential for us to recognize that fundamentally changing the way that the system is organized could help us save a hell of a lot of money and therefore be able to continue to guarantee care to people who are getting it now, who would not be getting it when the federal cuts go into effect. So we are relaunching this. This is something that's been around for a couple of years, but I believe that right now, particularly with what's happening with the federal government and the actions that they're taking, we have even more of an obligation in this state to demonstrate that it can be done. And I believe that we must do it. And I believe that with all of our collective efforts together, we're going to get there. So I'm looking forward to this coming year. But certainly I'm looking forward to the conversation we'll have for the next, for the next hour or so about why this is so essential in the state of New York and how we can get it done. Thank you, folks, for having us.
Thank you so much, Senator Rivera. We'd be lost without you. Thank you for your leadership and for your commitment to this fight. We appreciate you more than you know. Next up, I'd like to introduce a senator who is often described as the senator with the most enthusiasm. We're fortunate to have you here today. Thank you for being a forever champion. I'm pleased to welcome Senator Jabari Brisport.
Thank you, Melanie. Great setup for me. Appreciate the Campaign for New York Health and everyone that's attending and speaking. Really great to see this turnout here. Again, I'm State Senator Jabari Brisport from Brooklyn. I see some people are tuning in from Brooklyn, so shout out to BK. If anybody's from Bed-Stuy, I'm your guy. I've been a huge supporter of the New York Health Act since even before I was elected. It is a no-brainer, just no nonsense, a very obvious choice to make for our state, for our communities. Stuff is already bad. We have, 1 million uninsured in New York State, which is a huge number, many more of that underinsured, and it bears repeating, and I think everyone here will say it. We have these federal cuts coming from DC, and we may be looking down the barrel of a gun aimed at many of our hospitals, slotted for closure if these cuts manifest. But it does not need to be this way. It is not just the moral thing to do to give people health care. It is not just the moral thing to guarantee healthcare as a human right. It is politically the smart thing to do. When DC is saying less healthcare, we say more healthcare. When they are saying cut your hospitals, we are saying we're going to fully fund hospitals throughout the state and guarantee services to every single New Yorker, regardless of where you came from, what your job is, if you even have a job, or what you believe in. Everyone gets healthcare. And I will say, we're looking for leadership right now in these very, very scary times. This is our opportunity to show leadership, especially here in New York, in a very blue state, but also as our state itself. And I do think it can have a domino effect around the country. If you know the story of Canada, they passed it in just one province, Saskatchewan first, and then they passed it nationwide in Canada. So here's an opportunity to be the Saskatchewan of America, start off the first domino, and make sure that we set all of America on a path to getting universal health care. And I do want to shout out the incredible work of the Senate sponsor, Gustavo Rivera, of the former Assembly sponsor, Dick Gottfried, and the current one, Assembly member Amy Paulin. Thanks to all their work, there are enough co-sponsors on the bill in both the Assembly and the Senate to pass. If it's brought to a vote. So we need to get it to a vote, and that will only happen if we have a mass uprising of people from around the state, like the people who are on this call today. We need everyone calling out saying, we want this, we need this to happen, and thank you for feeling the fire in you, and let's get it done in 2026. Thank you so much.
Thank you so much, Senator Brisport, for being here today. And as I said, for your enthusiasm always on this bill. We appreciate the work that you do. Next up, I'm very pleased to introduce a wonderful Assembly member who is one of our biggest champions in that chamber, Assembly Member Levenberg.
Thank you so much, Melanie, and thank you to the entire coalition. I really appreciate you. I appreciate so much my colleagues. I probably was introduced to this legislation initially when I worked for Sandy Galiff, who's a good friend of Honorable Dick Gottfried, and that I became a big fan, similar to my colleague Senator Brisport, before I was even in office. I think that when we talk a lot about energy independence and how we need to be independent as a country from other interests. Well, right now, we need healthcare independence. And we can see that our federal government isn't doing the job the government is supposed to do, which is not taking care of people. And even people, we know that, again, as Senator Rivera said, we know that our system, even as it is now, is not working. Now it's going to be even worse. We're going to have longer waits at ERs because we're going to see hospital closures. And who's going to ERs? The people who don't have insurance. We're going to have 1.5 million people that are going to not be insured with these additional federal cuts. But we not not have to find the $13 billion that the federal government is going to leave whole in our state pocket for, but we're going to gain $20 billion in savings if we move towards this system, and we're going to make sure that everybody gets coverage. That is so important, especially given the rise in diseases, infectious diseases, given the reduction in needs for vaccines or coverage for vaccines. All of the things that we're seeing, knowing that infectious diseases don't know borders. They don't know who is here legally or who is undocumented. Those are things that diseases don't know. So somebody's uninsured and isn't able to get coverage for the things that they need to protect themselves against disease, we're all susceptible. We need to make sure that we have preventive care, and all of the other things that this wonderful bill adds, which is going to, again, cover dental care, long-term care, all the things that really do make people broke or if they need them and they can't get them. And we know how important dental care is and how horrible the coverage is. All of these things are going to get better with single payer health. We need to get the New York Health Act passed this session. I'm ready to go back for special session to get it passed because I know how important it is. And we absolutely need to be leaders, as Senator Brisport said. So let's go. Let's get this done. Let's convince everybody who's on the fence why they shouldn't be on the fence anymore. This is the time to do it. We need to see opportunity in this horrible challenge that the federal government has presented with us. Thank you.
Thank you so much, Assemblymember Levenberg. We appreciate your commitment and your drive, and we can't wait to work with you this year and beyond. Thanks for being here. Next up, I would love to introduce my friend and board member and president of the New York State Nurses Association Single Payer Committee, longtime New York Health Act advocate, Margaret Franks.
Hi, everyone. As Melanie said, my name is Margaret Franks. I am treasurer for NYSNA and chair of their single payer committee. And first, I'd like to start by thanking Melanie for putting this together, for Senator Rivera, Dick Gottfried, the other legislators on this call, and the other speakers who believe, just like we nurses do, that healthcare is a basic human right. I'm actually on this call today from my mother's house in Ireland. And like many other countries worldwide, Ireland is able to provide healthcare to all of its citizens and non-citizens. Any visitor here can get healthcare if needed, usually at little to no cost to themselves. America is usually held up as a beacon globally of what can be done and what is possible. So why is it in this area we're not able to do this? We're not able to guarantee healthcare for all. In New York, we have an opportunity to take the lead and show people that, yes, it can be done. And all it takes is dedicated people like the ones on this call today to stand up and say, it must be done. We demand it be done. Every New Yorker deserves care. We cannot understate the impact that this federal bill is going to have on the healthcare of all, our family, our friends, our neighbors, our community. As nurses, we follow a code of ethics every day to serve and protect every patient. And we go out there and we fight for them. We show them that we have their best interest at heart. When we go into a room or whatever setting we serve them in, we don't go in and ask them what type of insurance they have or if they have coverage. But believe me, it's always in the back of their mind. They know that if prescriptions are sent into the pharmacy, they may not be able to pick them up. They may not be able to access those specialist visits that are recommended. And we see them back. And as the Assemblywoman said, our ER waits are going to lengthen even more than they already are. Our healthcare system is stressed. It's under a lot of strain, and no more than in safety net hospitals and our rural hospitals, which are surely going to suffer the most. I work as a nurse in Poughkeepsie, New York, and Northwell just took over the hospital that I work in. So I know that we may not feel the same impact as some of my fellow NYSNA nurses up in Schenectady, in Bellevue, in Ellis, up in the Adirondacks. We will see effects no matter where we are, no matter who's following us. And a part of this is because there is profit in healthcare. That needs to be eliminated because as long as you have profit in healthcare, you will never guarantee equity to all. Thank you all.
Thank you so much, Margaret. Thank you for being here. Thank you to NYSNA for your long-standing commitment to this bill. We certainly wouldn't be here without you. For our viewers, the New York State Nurses Association is our longest they are our first and longest tenure of supporting the New York Health Act in the labor movement. We work very closely with them. Nurses are our front line of defense against any healthcare issue. So Margaret, thank you very, very much for being here. Next up, I am very pleased to welcome UAW Region 9A President of Local 2110, Olga Brudastova.
Thank you, Melanie, and good morning, everyone. As Melanie said, I'm Olga Brudastova. I'm the president of Local 2110 UAW, and we represent a variety of workplaces, small and large, across New York and other states. But in New York specifically, we negotiate contracts, multiple contracts every year, and every employer we negotiate with complains about their inability to negotiate with their health insurance companies and to actually have any leverage with brokers, especially smaller employers, especially smaller nonprofits. And having a New York Health Act passed would be a tremendous change and tremendous improvement to the current conditions of the state. And in addition, all the negotiations we have now, I think in all of them, employers are trying to take cuts to healthcare access to our workers, and the cost is essentially trickled down to the members who are already living paycheck to paycheck, who already don't go to ER because the copay is too high, who already complain about not being able to see specialists in a timely manner, even when their situations are really urgent and need urgent attention. So there is so much to fix, and the cost is one of the elements that we need to address first and foremost. Otherwise, people will be just falling off the healthcare system and falling off the care that they deserve. Thank you.
Thank you so much, Olga. We are so grateful to have UAW and our growing coalition. Thank you so much for being here. Next up, I'm going to introduce someone that should not be a stranger to any of us here, and certainly any of you watching. It's my real pleasure to introduce longstanding former member of the Assembly, former health chair, author of the New York Health Act, the one, the only, the Honorable Dick Gottfried.
All right. So almost every problem we face in health and healthcare as consumers, employees, employers, healthcare providers, taxpayers is made worse and harder to solve by the way we pay for healthcare. And the Trump cuts will make this much worse for all of us. You know, if you take money out of your local hospital, even a multimillionaire arriving with a heart attack is going to get care that is stretched thinner and is going to be more likely to die. A multimillionaire. And there is no plan that can deal with the Trump cuts and other issues without costing New Yorkers billions more, except the New York Health Act. It will save New Yorkers tens of billions that we now waste on insurance company bureaucracy, marketing, and profit, and healthcare provider administrative costs, and excessive drug prices. And that's going to free up more than enough money to fill these gaps. And, you know, there is no plan that anyone is looking at other than the New York Health Act that can do that. And it made enormous sense before Donald Trump thought of running for president. It makes even more sense now when he and Congress are ripping apart support for health care for millions of Americans. Thanks.
Thank you so much for being here, Dick. As always, we are so lucky to have you just as active in this fight as you have been for the last 30 years. We appreciate you, and thank you so much for being here. Next up, we recently heard from UAW Region 9A. Now we're fortunate enough to hear from Region 9. I'm here to welcome Wence Valentin, the Political and Retiree Director for UAW Region 9. Wence?
Good morning. My name is Wence Valentin III, Political Director, Retiree Director for UAW Region 9. The United Auto Workers have always stood where working people stand, on the front lines of the struggle, taking on powerful and winning against the odds. Our union's legacy is rooted in dignity, fairness, and collective power. We know that when working people are shut out of the conversation, they are denied the respect and the benefits they deserve. This is why the UAW organizes to build power in our communities, on the shop floor, and in the halls of Albany. We take on corporate greed. We fight for laws that lift up working families, and every victory we win strengthens not only the voice of our members, but the voice of working people everywhere, because our fight is bigger than us. It is the fight of working people across this state and across this country. Today, we are here because federal healthcare cuts threaten to harm working families. Washington has chosen to hand out tax breaks to billionaires while stripping healthcare from those who need it most. These cuts will double our uninsured population, force hospitals to close, blow a hole in our state budget, and skyrocket health insurance premiums for small businesses and working families. That doesn't sit right with me, and it doesn't sit right with the United Auto Workers. But here's the truth. New York doesn't have to take this lying down. We can fight back. We can protect our people, and we could do it by passing the New York Health Act. This legislation will guarantee health care coverage for every New Yorker, save families money, and keep hospitals open and strong. At the UAW, our fight has always been the fight of working people. And today we call on the New York State legislature to join us in that fight. Stand with nurses, stand with auto workers, stand with families across the state, fight back against a federal government that puts profits before people, fight back against billionaires' greed that exploits workers, fight back so every New Yorker, no matter their income, their job, or their zip code, can have a healthier future. Healthcare is a right, not a privilege. People over profits, working people united together in solidarity. We will pass the New York Health Act. Thank you.
Thank you so much, Wence. We really appreciate you being here. We appreciate UAW's commitment to the New York Health Act. And you're right, together we will win this. Next up, I'm also going to bring up one of our labor leaders from 1199. Welcome, Rose Gentiles.
Good morning. My name is Rose Gentiles. I am a member of 1199 SEIU and a CNA at Rebecca Rehab in the Bronx. Earlier this year, the federal government passed a bill that will cut $1 trillion from Medicaid funding across the country. This will result in millions of people losing their insurance and thousands of people losing jobs, on an overall decrease in access to quality health care. As a CNA of over 28 years of service working in the nursing home industry, I know firsthand how issues of low funding affects patient outcomes. Nursing homes across the state overwhelmingly rely on Medicaid as a primary service of funding. The majority of patients I serve rely on Medicaid to get access services. Medicaid was created as a resource for low-income families to be able to get healthcare services, regardless of their income. These cuts already push the struggling families further into a hole. New York cannot stand by and watch as the federal government gets access to health care. For our family health care, we must stand up and fight back. And we can do that by passing the New York Health Act. The New York Health Act will help us to ensure no New Yorkers goes without access to health care because he can't afford it. The New York Health Act guarantees complete health coverage, including medical, prescription drugs, dental, long-term care. This bill will ensure that patients affected by the Medicaid cuts will be able to stay in the nursing home and receive care and services as they should. Our labor slogan is, when we unite, we win. We demand for this bill to be passed now. New York Act, we demand for this bill to be passed. Thank you so much. Have a great day, guys.
Thank you so much, Rose. We appreciate your partnership. Thank you for being here, for using that powerful voice to speak out in favor of the New York Health Act. We appreciate it.
Thank you.
Thank you. Our next speaker is a wonderful advocate, I think an inspiration to us all. It is my pleasure to introduce the Interim Co-Executive Director for Citizen Action New York, Rebecca Garrard.
Thank you so much, Melanie, and actually permanent now co-executive director being rolled out, but here's a little bit of a spoiler, but thank you so much for having me on this call, and I feel so honored to be in this space with all of these brilliant people. Like all of the other speakers, I want to bring some truths, right? In this moment, the federal government's attacks on our healthcare are unconscionable. We are facing $13 billion in cuts to our healthcare system. We are facing 1.5 million New Yorkers who are going to lose coverage. We have 70 hospitals at risk of closing and 18 who are imminently at risk of closure. And yet, what do we also know? We know that this country's privatization of healthcare is always going to lead to corporate politicians and special interest money choosing profits over patients. This is a unique and massive current problem that we're facing, but the root of it has existed for a long time, and we will continue to have problems like this. The New York Health Act is the only bill in our state legislature that guarantees comprehensive healthcare coverage and guarantees universal coverage. It truly is the only piece of legislation that delivers a true healthcare system for every single person in this state. And so it is overdue that we pass this, but there certainly is no better time than now to ensure that every New Yorker can access quality healthcare. And so I'm enormously proud to be here representing Citizen Action of New York. I'm proud to be here in space with all of these other brilliant panelists to say that we must act now to pass the New York Health Act. Thanks so much for having me.
Thank you so much, Rebecca. Thank you for the work that you're leading at Citizen Action. Congrats for the finality of the title change. We're all lucky to have you at the helm. So we appreciate all the work you're doing, and we certainly appreciate your commitment to passing the New York Health Act. Next up, I'd love to introduce the Senior Director for Health Initiatives at Community Service Society. I think we can all agree Community Service Society does incredible work. They're really in the details about everything health with regard to New York, and she's sort of my go-to when I have a tough question. So I would love to introduce Carrie Tracy.
Thank you, Melanie. And I'd like to thank you for inviting me to join this amazing group of folks working to make sure that there's affordable quality healthcare for everybody in New York State. As you said, we work with networks of amazing partners to help over 130,000 New Yorkers every year access healthcare, to get insurance or use their insurance. And New York, we are lucky that we have amazing legislators like former Assembly Member Dick Gottfried and Senator Rivera, who've made sure that New York has been a leader in finding creative ways to cover more and more people and provide incredible coverage, from Child Health Plus, Family Health Plus, Essential Plan, all these great programs. So we're in a great place to be the state that leads on providing universal coverage. This is a terrible time, as everyone said. We see so many cuts coming from these federal cuts. And we're, again, really grateful that Governor Hochul and her administration and all of our legislators are working so tirelessly to find ways to make sure that people in our health system aren't impacted. But it's a huge challenge. And we know that folks around the country right now are ready for big, bold solutions. And the campaign for New York Health, the New York Health Act is definitely a big, bold solution that would help address cost, coverage, access to equitable care. And so that's why we're here today to say that we're excited about this campaign, and we'd like to see the New York Health Act be a solution to all of the problems that we're facing today. So we're here to join you all, and thank you.
Thank you, Carrie. Thank you for being here. Thank you for the work that you do. We're very grateful to work in partnership with CSS. Next up, I'd like to introduce another movement maker, someone that we are, pleased to work in coalition with and see her leading many, many fights across the political spectrum. But today we're here to talk about healthcare and the New York Health Act. So it is my pleasure to introduce the co-executive director for the Working Families Party, Jasmine Gripper.
Thanks for having me. Jasmine Gripper with the Working Families Party. So pleased to be joined by Working Families elected champions who are on this call, Working Families Party affiliates who are on the panel, and our leaders who are in the chat. I see you. The Working Families Party is a political party building power for everyday New Yorkers, making sure we have the things that we need. Like Rebecca said, we live in one of the wealthiest places in the world. There is no reason why everyday New Yorkers don't have access to the things that they need. It is our responsibility, it is our lawmakers' responsibility to make sure that New Yorkers have access to the things that they need, and not just the ultra wealthy and the 1%. Healthcare is essential. We need it for our children, we need it for our parents and adults, and we need it for our seniors. It is time for New York leaders to put urgency behind passing the New York Health Act, enacting this legislation now, and making sure we can keep New Yorkers healthy and whole, keep our hospitals fully funded and open, and keep our nurses with the support that they need. The New York Working Families Party is proud to support you in this effort, and we're ready to get this over the finish line as soon as possible. Let's not wait, and let's move with urgency. Thank you.
Jasmine, thank you so much. We share your enthusiasm. We are ready to get this over the finish line, and that's what today is all about. We look forward to working with you as we push the state legislature to fight back against federal cuts and pass the New York Health Act. So thank you, thank you, thank you. We can't wait to see what we're going to do together. Next up, I'd like to introduce Maria Ordonez, who is the political director for NYPAN, the New York Progressive Action Network, who has always had the New York Health Act as their #1 priority. So Maria, welcome.
Thank you so much, Melanie, and thank you to all of the coalition partners who are here today and are making this press conference and this movement happen. My name is Maria Ordonez, and I'm the New York Progressive Action Network's political director. That is NYPAN for short. And we are a progressive organization that has been fighting for the New York Health Act, universal health care, since we came about 9 years ago through the Bernie Sanders 2016 campaign, because we believe that healthcare is a human right. And today I'm proud to see so many allies, unions, healthcare advocates, activists, organizations, and elected officials join us in this fight. But we all know the reality of this moment. The federal government is cutting healthcare funding. And our fight is now more urgent than ever. Every budget cut means that New Yorkers will now have to choose between paying for rent, paying for food, or receiving medical care in this ever-growing unaffordability crisis. And the New York Health Act is the solution that we need now. It guarantees healthcare for every single New Yorker, no premiums, no deductibles, no copays, and puts patients over profits. It's a very simple idea, but it's just so hard for us to get it together, right? Patients over profits. And we have the power to lead. All of us in this call, all of the activists, all New Yorkers have the power to lead and show the federal government that when they fail, we're here to step up and take care of each other. Now, NYPAN has been in this fight for nearly a decade, and we're not stopping until every single New Yorker can access healthcare. We urge every single legislator, every activist, let's build a mass movement, let's organize together, and let's finally pass the New York Health Act now. Thank you.
Thank you so much, Maria. We totally see why this is your #1 priority. We've been in the trenches for a long time. We look forward to, as Jasmine said, getting this bill over the finish line and making sure that healthcare is a right for every single New Yorker. Thank you so much for being here. Next up, I would love to introduce the Director of Health Programs at Make the Road, Arlene Cruz Escobar.
Good morning, everyone. I am honored to be here in solidarity today with fellow leaders and advocates committed to advancing health equity for all New Yorkers. My name is Arlene Cruz Escobar, and I serve as the Director of Health Programs at Make the Road. We are one of the largest grassroots organizations fighting for dignity and justice for the immigrant and working class communities. As it has been made clear, our healthcare system is facing significant threats from loss of coverage, longer wait times for services, and overburdened ERs due to cuts in funding and changes in eligibility for coverage. Every New Yorker, regardless of immigration status, deserves access to comprehensive care within a system that prioritizes people over profits. Studies have projected that the New York Health Act would generate tens of billions, that's right, billions, as many have already said, in savings over the next decade, substantially offsetting the anticipated reductions associated with the horrific reconciliation bill passed by Washington this past July, all while giving access to coverage, including vision and dental, to everyone. It is a common sense solution. Healthcare is not a luxury, it's a fundamental necessity and a basic human right. Legislation that ensures universal access would alleviate the daily burden faced by millions of families forced to choose between essential needs and life-saving services and medication, especially in a climate where immigrant communities, including those who are here lawfully present, are increasingly under attack. We must reaffirm our commitment to protecting those who contribute meaningfully to our economy and enriching our neighborhoods statewide. This is a pivotal moment to advance equitable access to healthcare while protecting our most vulnerable. We must not allow the federal government to strip away our healthcare from our immigrant and working class communities to make the rich richer. We must work together. We must fight back to create the system that benefits everyone. So let's make this the year that we pass the New York Health Act. Thank you.
Thank you so much, Arlene. We've been together for a long time, Make the Road in the Campaign for New York Health, and we look forward to fighting for healthcare for everyone, every single resident in New York State. So thank you for your partnership. Next up, I would like to introduce one of our longtime coalition partners and wonderful New York Health Act organization, or fighting for the New York Health Act organization, is next up Julie Wegener, who is a board member for Physicians for a National Health Plan New York Metro chapter. Julie, welcome.
Thank you, Melanie, and thank you, everyone. My name is Julie Wegener. I'm a retired physician and a board member of Physicians for a National Health Program New York Metro chapter. As a physician, I have witnessed firsthand the cruelty and the racism inherent in our profit-driven medical system, and have long been an advocate for guaranteed, publicly financed, equitable health care. The federal government, as we know, is escalating the cruelty and the racism. Many more will suffer and many more will die. New York has a unique opportunity to reverse this devastation, to eliminate corporate greed from our health system, and finally prioritize the care in healthcare by passing the New York Health Act and passing it now. As I said, I'm a retired physician. One would think that means I'll be okay financially, but that is not the case. My husband has dementia, and we're spending our life savings paying out of pocket for his long-term care. I am 80 years old with medical issues of my own. After years of caring for my husband at home, he's now in a facility receiving excellent care. But I did the math. We have about a year to go before we run out of money and have to apply for Medicaid, which covers long-term care, at least for now. The solution? The New York Health Act will cover long-term care. Medicare does not, contrary to what many believe. This is a widespread problem. It's estimated that 70% of people over 65 will need long-term care. This could be any of us here and the parents of any of us here today. Do we just hope for good luck that we and our loved ones will never need long-term care? Is this reasonable in such a wealthy country? Why do we have to rely on luck instead of a firm foundation? The New York Health Act will provide that firm foundation, making long-term care services available to everyone, including a huge number of middle and working class New Yorkers who currently have no option except to go broke. Thank you.
Julie, thank you so much for being here. PNHP Metro, thank you for the work that you do. You're everywhere. We appreciate your spirit, your fight, and your commitment to passing this bill. So thank you so much. Next up, very exciting that we have the Lieutenant Governor of New York State with us here today, who recently came out with his support of the New York Health Act, and I will let him tell you why. Lieutenant Governor Antonio Delgado, welcome.
Melanie, thank you very much. I want to thank all the leaders, electeds, advocates, folks who have been in this fight for a long time. I am grateful for your leadership. I'm grateful for your commitment to elevating the cause, the New York Health Act, and not just the cause of the New York Health Act, but the cause of universal care, the cause of putting care before greed, the cause of putting people before profit. This is a moral, a economic, and a political imperative, all of which, in my estimation, are coming to the forefront at this very moment. It is a moral imperative, I think, for obvious reasons. We're talking about a basic human right. And far too many of us across America have bought into this lie that we are actually paying for healthcare. Our system is one where we are paying for insurance. And we know the effect of when you pay for insurance versus paying for a system of care that we collectively all buy into, and as a result, comprehensively are looked out for, as opposed to exploited for profit. That is the shift in a moral conversation that I think everybody understands and fundamentally on a human level appreciates. And that is why when somebody says they're going bankrupt over a healthcare bill, on a human level, it is devastating to hear, particularly in the richest country the world has ever known, and particularly in one of the richest states here in America. We have an obligation morally. We also have an obligation economically because we are throwing money away into our insurance system with all of the bureaucracy, all of the middlemen, all of the folks who go out of their way to extract value from this care system at the expense of people. And this has happened for decades. The premiums continue to rise, deductibles rise. And as a result, we see the trend lines are only getting worse and worse and worse. There has been no improvement when it comes to the cost of care. And despite the increased cost of care economically, the quality of care across the board has not remotely kept pace. And so economically, we have an obligation. And now, with a president and a Congress dead set on throwing gasoline on this fire and doing so in a way that directly attacks New York, it is a political imperative now more than ever. And when you look at the stakes, both from a moral, economic, and political standpoint, and you look at what New York represents, not just for New Yorkers, but for the country and the world over, it is so imperative that we all come together in this moment and we fight for a more humane, more just, more fair, more equitable system of care, and take all the work that has been ongoing for many, many years here in New York, work that you all have been doing for many, many years, and push this over the finish line to meet this moment. Again, to do so in a fashion that meets the morality of it, to also create economic sustainability for this state and how we proceed, given all of the cost savings that we will benefit from by moving beyond the insurance system. And yes, to fight politically against the onslaught that is coming out of Washington. And if we're not willing to fight now for folks who are being literally sacrificed by this administration in Washington, the question will remain, when? When will we be able to muster not only the resources, but the political will and the moral courage to do so? So I am with you in this fight, and we will collectively do everything we can to elevate this issue and make sure that every New Yorker, and I'm going to tell you right now, I know, and you all know, New Yorkers are ready for this. This is not a question about what New Yorkers are ready for. This is not a question about what people in rural New York or in urban or downstate or upstate or central or western, because I'm all over the place. And everywhere I go, people are frustrated and desperate for more. And they don't want the management around the edges. They certainly don't want us to retreat and to let communities suffer. What they want is for us to step up and be the best absolute versions of ourselves. And if we can't do that now, I worry, when will we be able to do so? So I appreciate all of you. I'm grateful for all of you. This is a fight that I'm in it with you on, and I'm excited about what we can represent for ourselves here in New York. And again, for the country, leading the way on an area that we know is essential to the welfare and well-being of all New Yorkers, every single last one. So thank you. I appreciate all of you, and I'm very, very, very grateful for the work that you have all put in this endeavor.
Thank you, Lieutenant Governor. We are so proud to have you standing with us in this fight to pass the New York Health Act. I'd like to thank all of our incredible speakers, our movement makers, our labor leaders for being here today and for being in this fight with us each and every day. As we close and wrap up this incredible press conference, I do want to underscore a couple of points. These federal healthcare cuts threaten all of us. They threaten to double our uninsured population. They threaten to explode and skyrocket health insurance premiums. They are threatening over 70 hospital closures around the state, and they will blow a hole in our state budget. There is only one solution that solves for all of those issues, and that is passing the New York Health Act, which will cover everyone with comprehensive and upgraded care, lower costs for families, keep hospital doors open, and fill that state budget hole. That is what the New York Health Act will do. So I want to be clear that the road ahead will not be easy. We all know that. But this state legislature has a choice. It can let New Yorkers get sick, go broke, and die, or it can fight back. Fight back, protect our people, pass the New York Health Act. And I'm going to say this as plainly as I know how. From me and all the other folks on here that were on in this press conference today, this fight only ends one way, and it ends with us winning. That is our commitment, and that is what we intend to do. So if you are ready to join this fight, if you are ready to fight for something, if you are ready to fight for the New York Health Act, then join us. Join our movement. Visit our website at nyhcampaign.org. Visit us on social media or reach out to me directly. We will win this fight. Thank you so much for being here,